All the information provided by OneMedicine and associated podcast are strictly for information purposes only. Hi, and welcome to OneMedicine Podcast. This is where we discuss everything from clinical case scenarios, latest journal articles, to the challenges in everyday lives of doctors. I'm your host, Dr. Srihari Kulkarni, internal medicine resident working in Bangalore. Today we have with us Dr. Rahul Rao, who is a psychiatrist. You know what? I'll let him introduce himself.
Hello everyone. On this platform, I'd like to thank Dr. Srihari for inviting me for this podcast. So I'm Dr. Rahul M. Rao. I'm a consultant psychiatrist working in Mangaluru, and I also work at Father Muller Medical College. And psychiatry has been one of my go-to branch from my UG during my UG days itself. So I used to read a lot about psychiatry topics and participate in the undergraduate quiz, etc. at that point of time. And from then on, I developed the interest, in this particular field, and completed my MD from MS Ramaya Medical College. And I also have a DNB degree in psychiatry from the National Board of Examinations, Delhi. I think that should be enough for a short, brief introduction.
Welcome to the podcast again. A couple of days back, I was going through the internet and found about this lady called Rosie Bartel. She's a very interesting and very inspiring woman, actually. So she initially developed septic arthritis after a knee procedure a couple of years back. Somehow the procedure didn't go well and she ended up having a lot of complications. And to be precise, she had around 4 progressive amputations, one after the other, and around 200 plus hospitalizations and 100 plus blood transfusions also. Many a time she was admitted to the ICU with sepsis and septic shock and all of that. And she was, at one point, she was told that, she would have a survival of around 30%. So she's also written a book, and she's a very inspiring woman in general. So you can learn more about her on her website, and you can just Google search about her. Her name is Rosie Bartel. Now presently she's representing a family and patient advisor group also. Throughout the process, the team of the doctors who are treating her have been the same. We know for sure that the patient went through a lot. The patient went through a lot, both physically as well as psychologically, because she had to go through a lot of the uncertainties in her life in general, and also the pain and all the hospitalizations and what it has done to her family is quite devastating. But that is one perspective, one way of looking at it. When we look at the doctor's side of it, they couldn't help her in treating completely, and they couldn't tell her that this is the day we are discharging you and you're going to go home and you're going to live happily. You won't have this problem come up again. That has been a constant reminder for them, for the whole team of doctors throughout their process, throughout the journey. So how do you think doctors usually process the failure or things that are out of their control, out of their hand? And do doctors have any different way of looking at these things when you compare it with the normal population, with the non-medical population?
Yeah, first of all, this case is actually very intriguing. The amount of surgeries that she has undergone and the recurrent hospitalizations and recurrent need for procedures, that's very devastating indeed. But not many patient attenders or the healthcare professionals, be it the seniors of the medical fraternity in your medical team, they always look at such a case from one side, like from the patient's point of view only, like patient sufferings. But it's always most often we tend to not pay attention towards the doctor's mental health or doctor's feelings. So definitely, like you mentioned, repetitive admissions and having to do a lot of procedures again and again, not seeing success in the procedures that the surgeon would do, it actually puts a surgeon in a fix. And it's at times it's frustrating. And rather than seeing it as a failure, like you said, It's more of there are multiple factors, as we doctors are aware, that every case that we take, whether it is in this case Rosie Bartle, or it's something to do deal with osteomyelitis or an autoimmune condition or malignancy, every case is different. And it's in medicine, 2 plus 2 is not equal to 4. We all know that it's not like math. So every individual responds differently to different therapeutic process, different treatment process. So and also the comorbidities that the patient has, hypertension, diabetes, etc. So one way is to accept the patient, as it is, in the sense, okay, this patient is not responding the way I expected the patient to respond. What could be the reason? First and foremost, we after a surgery, we tend to look at the sugars or any other comorbid related factors to try and control it. That is the first thing. And still, it's not happening. Recurrent infection. What is the cause? And probably in this case, after all the the things that has been done, still there are problems that are not solved. It definitely puts the doctor pushes him or her towards frustration. So like I said, the first step is to introspect as to whether something else can be done apart from the normal approach that I'm doing, something different from the routine approach. Second is they have tried all the different possible things and still the patient is not responding. The blame should not be put on ourselves. It's not just on our shoulders. We as doctors, we try our best, always try our best, give the best possible outcome for the patient. But I know it's disheartening when a patient does not respond or does not recover to the expected level, but it's not like we can always perform at our 100% efficiency. And even though we perform at our 100% or like say 90-95% of efficiency, there's always this X factor due to which we are not able to see the expected results. So that X factor, also like you can call it as factors that are not known. So that has to be taken in the sense of acceptance that there are some cases where I've done my best and I'm not able to do anything beyond a certain point, and accept rather than feeling sad or disheartened about it. Whether it is in this case or any other branch of medicine, when a patient does not respond and is chronically ill, there's an extent to which we can do. But beyond that, we have to leave it. People who believe in God say leave it to the God, or like leave it to the natural course of the illness, or how the nature tends to heal on its own. That kind of a thing. The other question that you asked, how a doctor should deal with it.
Yes, how do doctors have different way of dealing with it or looking at these things?
Definitely, because every doctor has a different way of dealing with stress, right? Every individual, for that matter, has a different way of approach to stressors in life. And it could be all the time, just work definitely is going to increase the stress and increase the frustration. So the ideal thing is, whenever you get a little time, you have to focus on other things in life as well. Some hobby, some sort of stress buster, go and work out a bit, or watch a favorite movie, or talk to your friends, or spend the weekend away from home. So these kind of short breaks, extracurricular things that you do will definitely help you recharge yourself and get back to the case or the work environment that you were previously in. That's one way of dealing with stress.
Yeah, so very well pointed out. Actually, it is very important for us to, the moment we understand that the patient or the individual is beyond whatever trials we have done, we should come to that acceptance stage, I think, so that we can try to conserve our mental energy, as we call it, so that we do not harm the patient. We do not harm the patient. At the same time, we do not harm the other patients as well, right? See, because we have several patients whom we have to take care of. We cannot say this patient is close to me, so I'm going to give more attention to this patient. All patients are equal. Of course, some patients have some serious conditions for whom we have to give a lot of attention when it comes to assessing the situation and evaluating further. But at the same time, we have to conserve the energy. It's basically more like triaging there. So we do not have that burnout phase where we'll be stressed out a lot, and then we'll end up harming the other patients as well. And when we look at these kind of emotions that the doctors have, we have known that there is a growing evidence of increased prevalence of psychological problems, especially the stress, depression, anxiety, and even substance abuse for that matter. Doctors have a very high prevalence of substance abuse disorders as well. And that feelings of burnout among the medical professional all over the world is very, very rampant, especially in a country like India, where the doctor to patient ratio is not that good. Very understaffed settings a lot of times. And many a times the patients themselves are quite difficult to deal with. What kind of factors do you think contribute to these growing psychological problems in doctors in general? What are the factors? If you have to list out a couple of factors, how would you list them? How would you rank them?
Yeah, see, very beautifully that you mentioned that the first and foremost, India is a developing country and the population is humongous. Every 50,000 population, there's one physician in India. And if I have to talk about psychiatry, the ratio becomes one psychiatrist to 2 lakh people. So you can, just imagine the amount of burden that is there on the doctor's shoulders, the amount of stress and strain the doctors faced during the COVID. All the doctors had to really work overtime. So first and foremost thing is the doctor-patient ratio, which we can't do much of anything about. What is in our hand? The thing is time management. So that is something which we can do something about. Most often what doctors do is they don't take care of themselves. You ask about 10 residents, how many of them have had breakfast every morning? Out of that, at least 8 to 9 doctors wouldn't have had breakfast. This is definitely the case. I am pretty sure that all over the country, most of the doctors, young doctors, residents, they don't have a fixed time schedule, where they eat or when they sleep, and whether they interact with their family. So first and foremost, we are human beings. We are not, descendants of God, or we are not come from heaven to work like machines. After all, we are human. So every human being needs adequate amount of food, sleep, rest, and interaction with other, people around, other family members, relatives, whoever it is. Because after all, man is a social being. So, during our course of studies or medical studies, or when we work, we tend to forget this main thing. So first and foremost, we need to be little selfish and take care of ourselves, get good amount of rest, talk to people around. This itself reduces a huge amount of stress. Second important thing is, it's easy for anybody to procure substances, maybe sleeping pills, or maybe propofol, or other stimulants. It's true. The abuse in the doctor fraternity is high, but it's not that all the doctors are doing it. So what's the underlying key factor that is responsible for this? It is the individual personality. Yes, we are doctors, but underneath our aprons, we are humans. So every individual is different, and every individual's personality is different. The way we react to stress is different. The response to stress is different. So there are individuals who like to reduce the stress by having a chocolate or a brownie, or there are other doctors or other people who would like to reduce the stress by brownie mixed with weed, or alcohol, or some other substance. So it ultimately depends on the individual. The accessibility is not the only concern here, if you would ask me. It's about how we deal with stress. So ultimately, if you increase the amount of positive ways to cope with stress, automatically the negative ways of coping will reduce.
I guess you summed up really well. Given the fact that doctors are under constant stress and every individual is very different, and the way they cope with the amount of stress is very different, and also the fact that the availability of these substances is quite easy compared to the general population. All of these factors contribute a lot to the development of these psychological problems. Very well pointed out. How often do you think a doctor should introspect? Okay, let us say this is the situation right now, and I would like to stop at this point and have to question myself. Am I doing the things right? Am I doing anything wrong that can harm me or my family or the patient or the patient's family? How often do you think a doctor should do that? Is there a red flag that the doctor should, the moment the doctor notices, he should stop what he's doing and should introspect? Or how do you think doctors should go about it in general?
Yeah, see, this is an excellent question, because most often we tend to, kind of believe that this is normal, this is how medical field is, stress is definitely there, and not having enough rest and resorting to maybe alcohol, smoking to reduce stress. It's pretty normal, yaar, usme kya hai, like that kind of a attitude is there. But when to actually seek help? So how often do the doctors get stressed? See, the highest level of need for care starts from casualty, the emergency medicine. So it's, the emergency medicine is a place scenario where everything has to happen in seconds, fraction of seconds to minutes. So definitely the stress is very high. So a doctor who's working in the emergency medicine department, who's attending a call in casualty, is definitely bound to have excess amount of stress, versus a doctor who's relatively dealing with patients who can, more or less wait for their turn to be attended to, etc. So it depends. It's a gradient starting from casualty to the other end, where a patient can be treated in a couple of hours or even maybe on a follow-up couple of days, that way. Burnout, what we call as burnout, is pretty common in these doctors. And when it is coming in the way of day-to-day activities of that particular doctor, like not able to sleep properly in spite of not having duty. Let me repeat it. Not able to sleep, not because of workload, but I'm back home, but still it's running in my head that what happened, did I attend that case properly, did I do everything right for that patient? Oh, tomorrow morning I have a case posted, is everything okay? Am I ready for that case? So that kind of things, when when you're not able to have a work-life balance, or your work continues even after you come back home, you're not able to interact with your family, not able to watch your favorite movie or have a favorite meal, that is when you have to start introspecting. That's when you have to start thinking, maybe something is not right. I need to try my best to have a balance between my personal life and my work life. And sometimes you can definitely deal with it on your own, by the suggestions that I gave previously, like resorting to hobbies or taking time off, taking leave for a few days, things like that. When after all these attempts it does not happen, then you definitely will have contacts better than a layman with psychological help, that is whether it is a clinical psychologist or a psychiatrist. And if you are not able to do it on your own, you feel free to contact your colleague.
If and when the doctor is stressed out, they should take adequate breaks from their routine and not stress themselves too much. And even after that, if the doctor still feels that something is not right, he or she can always have a psychiatrist's opinion. Their colleagues will be able to help them.
Definitely, and the stigma should come down. The stigma towards mental health, that only people with chronic illness, psychotic illness need to meet a psychiatrist. That's not how it is. So psychiatrists and psychologists deal with stress related issues as well, like work related stress or any other family stressors, anything. It could be anything. And sometimes just venting out helps. Venting out and discussing about problems makes you get relieved of the stress. So that should be tried now and then whenever required.
Oh, very true. Actually, that is a very important point. That even just talking to a fellow colleague, just venting out about some stressor would bring a lot of relief. It doesn't necessarily have to be an outburst over a drink or over dinner. It can just be hey, I want to talk to you about this case or something like that. Of course, confidentiality should be maintained. At the same time, we can talk about it and just vent out the general emotions so that it's a bit toned down instead of those outbursts or impulsive behaviors or all of these substance abuse arising out of these stressors. Now, given that all of these doctors and so many of your patients come to you with so much of their confidential information, sometimes it's very disturbing. Sometimes, for example, they might have had a childhood abuse history or some sort of physical trauma or even some stress or some stressful situation that they had, which is very disturbing, which can be very disturbing at times. So, how do psychiatrists in particular deal with these kind of emotions? What mechanisms do you have? I'm very curious because now you are on the other side of the curtain, so you will know all the mechanisms and all the ways people usually cope up with all of these things, their venting out mechanisms, their coping mechanisms, and all of these. I would like to know how a psychiatrist would deal with those things.
Yeah, Dr. Shriyari. So I often get asked this question as a psychiatrist. How do you deal with people sitting in front of you and venting out their deepmost, innermost secrets, and when they cry in front of you and they're tearful and they burst out? So how do you handle? I do get asked this, and it's like I give this analogy. The first day of your medical school, that your anatomy dissection at the dissection hall, most of us felt grossed out looking at the dead body and the formalin smell that hit our neurons. But over a period of time, we got used to it. We overcame the stench of the formalin. It became like it's a everyday routine. Another similar experience is when you are in internship and you're assisting surgery, and the sight and the smell of blood, the first sight of blood, would have probably made you a little dizzy. But over a period of time, you were successful in helping out and retracting or suturing this particular patient of yours. And this quite the similar way. It's how a psychiatry resident is, builds his resilience and builds his stamina towards handling these issues. So basically, it's part of the training. And I'd like to introduce two terms here, which is commonly used in psychiatry. That is sympathy and empathy. So sympathy is something feeling really, pity and bad for the patient. So that kind of attitude towards the patient. Versus empathy. Empathy is something to get into the patient's shoes and keeping a note of patient's experiences, but not getting emotionally involved. See, when I sit in front of a patient who's tearful or discussing their secrets or very traumatic events, I can't get carried away with the patient and cry sitting next to them, because my job as a psychiatrist is to be there and help them stand on their feet and get back to their routine. So that's exactly what comes to my mind when somebody is in front of me who's tearful and wanting, because they have come to me for help. They have come to me to get better. And I can't, get emotional or lose my senses at that point of time. And that again comes with practice. You will be able to differentiate the work-related emotions and the emotions faced in your personal life. So it again comes with practice. That's why they say only if you're mentally very strong and you're able to handle the emotions, then you should take up psychiatry. Otherwise, sometimes the psychiatrist can get carried away with a lot of traumatic details or the emotions of the patient.
True. So sympathy and empathy are very important for a psychiatrist or even for any other specialty for that matter. Have you ever faced a situation where a patient or any doctor has confided in you something so important and so serious that has happened in their life that it requires some sort of help that is other than medical help. For example, they've been a victim of some abuse, and even then, even after being abused, they wouldn't want to go to the police or any other authorities, and they just confided that in you, and they expect you to keep it inside you. Do you feel it is important to make sure that the patient understands that it should be brought to a notice of someone, some sort of authoritative person, or do you feel okay, the patient will never mind, the patient will is never going to agree to what I am going to tell, so I might as well just tell it to someone so that patient is not going to suffer further about it? At what point do you think the doctor should intervene in such a situation?
Yeah, so again, quite often as a psychiatrist, we come across this situation, whether it is a childhood trauma or a extramarital relationship that the patient does not want to be disclosed to the partner, or it could be a suicidal idea that the patient is expressing and telling the psychiatrist, don't tell anybody, I'm not going to do anything, just keep it to yourself. So the first and foremost thing that's important here is whether the patient is an adult or the patient is a minor. So if the patient is a minor, then definitely we will have the right to inform to the next, the kin of the patient, that's the patient's parents or the guardian. Child does not have all the rights to, keep the information to themselves, because what if the child is having suicidal ideas and is not expressing to anybody? So that is when we have to take that step to disclose it to the family members. Now the second scenario, when this is an adult and the adult is in their senses, this is not a psychotic patient where the insight is lost. Now the insight is means awareness and acceptance that there is a psychological issue that I am suffering. So most often in psychotic patients, there is lack of insight or extreme cases of depression or bipolar disorder. So when the insight is not there, then definitely the patient is not in a condition to take make decisions on their own. That is when we have to break the confidentiality, because if there is harm to oneself or the others around, if the patient comes and tells that I want to kill somebody, that is when we have to breach the confidentiality, because ultimately it's about lives. Lives are concerned here, be it the patient's life or the life around the patient. So that is one instance where breach of confidentiality is warranted. And the other cases where if it's an extramarital issue or if it's a childhood trauma, here the individual as an adult has the right to withhold that information, because I'm a psychiatrist here and I'm not a police or a advocate here to give them advice or guidance as to what is to be done. Or I'm not a leader of the panchayat to try to patch up things or try to intervene. My job as a psychiatrist is only to help their minds, right? So I ask them if it is bothering you, or rather I suggest to them that it is better that you disclose this information by yourself to your family members, to your spouse, because it is ultimately it's going to only increase the amount of stress for the individual. So it depends on them, because here it is, when it comes to these issues, it's the life of any individual is not directly at stake. A mature adult with insight into their illness has a right to withhold certain information as long as this information is not causing harm to anybody.
So insight is more of a deciding factor in such a situation. And just to be clear for our listeners and our fellow doctors, this is not a legal advice or a medical advice. If there is any patient who you feel requires some sort of disclosure, it's better to talk to the legal team or the ethics committee or some other doctors so that you can come to a conclusion about it. People say laughter is the best medicine. So what is your opinion on that?
Yeah, definitely. There's no second thought about it, Shriyari. So, any sort of stress or tension, laughter, in fact, is one of the defense mechanism. One of the defense mechanism is called as humor. It definitely doesn't cause any harm to anybody. So, it's one of the very healthy ways of coping. Watching a comedy movie or just going out with your friends and cracking some, lighting up the moment, enjoying the moment and laughing it out is definitely going to help in a long way.
There is something that I've come across very recently. It's called 3 N's. So these are basically tools to tackle pain. So these 3 N's are to notice, name, and normalize. Do you approve of this kind of a tool?
Yes, absolutely. And you spoke about 3 N's. I'd like to introduce 1M. That is called as mindfulness. Okay, you might have heard about mindfulness. Mindfulness covers all these 3 N's that you spoke about. Acknowledging your surroundings and your presence, and not dwelling in the past or not dreaming about the future. That is mindfulness. So it's actually a part of the therapy called as cognitive behavior therapy, which definitely helps in dealing with a lot of psychological symptoms as well as physical pain symptoms.
So mindfulness is another very important thing that a doctor should always have. Again, people should not lose their minds when treating patients, especially when treating the patients.
To summarize all of it, life is not just about work, not just about money, and not just about the time spent with your patient. I'm not asking you to be selfish here, but there is also something else apart from your medical life, because I'd like to repeat again that after all, we are all human beings first, and then we are doctors. And we are constantly under the pressure that it's a noble profession. You're always meant to be in a particular way, dress up in a particular way. You have to act according to guidelines prescribed. But getting too much on track also is going to be bad. Anything in excess is going to cause harm. So a work-life balance is what I'd like to stress here. You have to also have some sort of a hobby, be it gardening, dancing, or whatever. Basically, balance your time, balance the 24 hours that you have got, and whenever it's required for you to consult somebody. I'd actually, wouldn't want to call it as a consultation, because we are brothers and sisters of our same fraternity. So it's more of a approach or a talk with your buddy, a psychiatrist or a psychologist, whoever it is. Do not shy away from seeking help. I really hope that the amount of stress and the violence on doctors reduces, and the doctors would get a lot of energy and peace and calm to serve the society in a better way.
It brings me immense pleasure to have you on this podcast.
Thank you, Dr. Shriyari, for having me on this platform, and it's my pleasure to be a part of this very beautiful initiative that you are doing. And I wish you all the very best, and huge loads of success will definitely come your way as you proceed with the other podcasts. I can also tell my email ID. You can reach out to me at drrahulraom, that is Dr. Rahul Rao M @gmail.com. You can write to me and I'll be happy to get back to you.
Thank you for listening. I'm your host, Dr. Srihari Kulkarni. If you want to listen to more of our cool content, you can check out our website, OneMedicine.world, or you can even go to our YouTube channel by the name OneMedicine, and even follow us on Instagram channel.